Hello, my name is Sue Barnes. I'm a consultant nurse in pain management. I work at Salford Royal Hospital and I see many patients with a diagnosis of multiple sclerosis who have ongoing persistent pain. Quite often when we have an area of our body that aches, so we've all at some point pulled a muscle maybe in our backs, or we've done a little bit too much gardening, so that intense achy sensation in an area is what I would call a muscle skeletal pain. It sometimes feels like it would get better if I rest or with heat, whereas a nerve pain feels completely different. So people would describe this as a burning, shooting, electric shock type pain. Quite often it will radiate down very quickly, suddenly, and sometimes with no apparent reason. So they do feel completely different. They are. So you would find that your GP or whoever you see with your MS condition will be very interested to hear about how you describe your pain. So any sort of muscle skeletal pain, pain on movement and bending, they will be treated with your traditional pain-killing tablets like codeine, paracetamol, maybe a short course of ibuprofen or naproxen. Whereas your other pain, your neuropathic pain, your burning, shooting pain, these types of pain are treated with medications that are not traditional pain medications. So medications that are traditionally been used for depression and for epilepsy can actually be very effective at calming down those misbehaving pain nerves and stop them firing constantly. Unfortunately, they can't completely stop that sensation. They can only reduce it to more of a background level. I think that's a great question because it is, I feel, very much teamwork. So the medication only plays a small part. We say maybe 30-40% pain relief your medication will give you, but how you manage your day-to-day activities and your MS condition will also play a big contributing part to living with MS and with pain. So we talk a lot about pacing our activities. We talk about the benefits of relaxation and mindfulness. We know that living with pain is extremely stressful, and it is a natural stimulant to our body to make us feel more anxious. We produce more adrenaline, and adrenaline fuels our pain nerves even more. So any way that we can help to decant some of that stress that the pain brings along is great to looking at managing this long term. So I think it is very much you having a role to play, and looking at self-management strategies is great. Some people use Tai Chi or Pilates. Mindfulness we spoke about as ways to help to stay active, but also try and reduce the everyday stress of being in pain and living with MS. I think this is something that we hear an awful lot. So as human beings, I say we are not robots, so pain is very much not just a sensation, it affects our thoughts, feelings and emotions, and they're very much going hand in hand with each other. Being in pain is distressing, and it can make us feel very helpless, it can make us feel really frustrated, and eventually can make our mood feel a little bit low, and we can feel depressed. We know if our mood gets low, it's as though somebody then turns up the intensity of our pain. So it is important to recognise when your mood is a little low and try to look at the things that you enjoy doing and doing some of those activities. Sometimes we get very focused on doing the everyday tasks that we must do, rather than thinking I've only got so much time or energy to do something in a day. We always say try and make that to be an activity that you find pleasurable or enjoyable, because that will release your own natural endorphins, which are your feel-good chemicals, which will be a way of helping to lift your mood in a more natural way. We do see lots of people with MS that also unfortunately have facial pain as a result of trigeminal neuralgia. I would say that will be something you need to seek advice with your GP, and they may refer you on to a specialist pain centre for management of that. We know that sometimes surgery around that trigeminal nerve can be helpful, or coating it with a glycerol injection puts a coating around the nerve and stops it being as sensitive. That unfortunately though is surgical. It's a surgical procedure which also comes with risk, but it does give us usually a really good outcome of stopping the pain. Alternatively, if we feel the trigeminal nerve is misbehaving and firing, but it's not being compressed or there's nothing irritating that nerve, then we look at medication options. And that would usually be carbamazepine, would be the drug of choice that your GP may start you with, or someone on the MS team would start you with. Quite often our GPs are very knowledgeable about the right medications to put you on, or it may be the MS team, someone in that team will be able to help and support you. There is the option to ask to be referred to a pain centre, and we see people who have got long-term pain as a result of MS, who maybe medications are helping a little but not a great deal, and we look at helping people to learn how to live with pain and how to manage it differently. We don't have any magic drugs, but it is very much about that self-management role and getting a better understanding about your condition, but how to stay active and how to not allow your mood to get affected as a result of being in ongoing pain.